for calling the Customer Service Center for the Pfizer-BioNTech COVID-19 vaccine, also known as Comirnaty COVID-19 vaccine, mRNA. Please note that we do not have specific information regarding when vaccine labeled as Comirnaty will be available. The FDA-approved Comirnaty and the FDA-authorized Pfizer-BioNTech COVID-19 vaccine under EUA have the same formulation and can be used interchangeably to provide the COVID-19 vaccination series. The emergency uses of the vaccine have not been approved or licensed by FDA, but have been authorized by FDA under an emergency use authorization, EUA, to prevent coronavirus disease 2019, COVID-19, for use in individuals 12 years of age and older. The emergency uses are only authorized for the duration of the declaration that circumstances exist justifying the authorization of emergency use of the medical product under Section 564(b)(1) of the FD&C Act, unless the declaration is terminated or authorization revoked sooner. Before we continue, I need to share the following important safety information with you. Indication and authorized use. How is the vaccine given? The vaccine will be given to you as an injection into the muscle. The vaccine is administered as a 2-dose series 3 weeks apart. The third dose may be administered at least 4 weeks after the second dose to individuals who are determined to have certain kinds of immunocompromise. A single booster dose of the vaccine may be administered to individuals 65 years of age and older, 18 through 64 years of age at high risk of severe COVID-19, 18 through 64 years of age whose frequent institutional or occupational exposure to SARS-CoV-2 puts them at high risk of serious complications of COVID-19, including severe COVID-19. The FDA-approved Comirnaty COVID-19 vaccine, mRNA, and the FDA-authorized Pfizer-BioNTech COVID-19 vaccine under emergency use authorization, EUA, have the same formulation and can be used interchangeably to provide the COVID-19 vaccination series. Comirnaty COVID-19 vaccine, mRNA, is an FDA-approved COVID-19 vaccine made by Pfizer for BioNTech. It is approved as a 2-dose series for prevention of COVID-19 in individuals 16 years of age and older. It is also authorized under EUA to provide a 2-dose primary series in individuals 12 through 15 years. A third primary series dose in individuals 12 years of age and older who have been determined to have certain kinds of immunocompromise. A single booster dose in individuals 65 years of age and older, 18 through 64 years of age at high risk of severe COVID-19, 18 through 64 years of age whose frequent institutional or occupational exposure to SARS-CoV-2 puts them at high risk of serious complications of COVID-19, including severe COVID-19. Important safety information. You should not get the vaccine if you had a severe allergic reaction after a previous dose of this vaccine, had a severe allergic reaction to any ingredient of this vaccine. Tell the vaccination provider about all of your medical conditions, including if you have any allergies, have had myocarditis, inflammation of the heart muscle, or pericarditis, inflammation of the lining outside the heart, have a fever, have a bleeding disorder or are on a blood thinner, are immunocompromised, or are on a medicine that affects your immune system, are pregnant, plan to become pregnant, or are breastfeeding, have received another COVID-19 vaccine, have ever fainted in association with an injection. The vaccine may not protect everyone. Side effects reported with the vaccine include: there is a remote chance that the vaccine could cause a severe allergic reaction. A severe allergic reaction would usually occur within a few minutes to 1 hour after getting a dose of the vaccine. For this reason, your vaccination provider may ask you to stay at the place where you received your vaccine for monitoring after vaccination. Signs of a severe allergic reaction can include difficulty breathing, swelling of your face and throat, a fast heartbeat, a bad rash all over your body, dizziness, and weakness. If you experience a severe allergic reaction, call 911 or go to the nearest hospital. Myocarditis, inflammation of the heart muscle, and pericarditis, inflammation of the lining outside the heart, have occurred in some people who have received the vaccine. In most of these people, symptoms began within a few days following receipt of the second dose of the vaccine. The chance of having this occur is very low. You should seek medical attention right away if you have any of the following symptoms after receiving the vaccine: chest pain, shortness of breath, feelings of having a fast beating, fluttering, or pounding heart. Side effects that have been reported with the vaccine include severe allergic reactions, non-severe allergic reactions such as rash, itching, hives, or swelling of the face, myocarditis, inflammation of the heart muscle, pericarditis, inflammation of the lining outside the heart, injection site pain, tiredness, headache, muscle pain, chills, joint pain, fever, injection site swelling, injection site redness, nausea, feeling unwell, swollen lymph nodes, lymphadenopathy, decreased appetite, diarrhea, vomiting, arm pain, fainting in association with injection of the vaccine. These may not be all the possible side effects of the vaccine. Serious and unexpected side effects may occur. The possible side effects of the vaccine are still being studied in clinical trials. Call the vaccination provider or your healthcare provider if you have any side effects that bother you or do not go away. Data on administration of this vaccine at the same time as other vaccines have not yet been submitted to FDA. If you are considering receiving this vaccine with other vaccines, discuss your options with your healthcare provider. Patients should always ask their healthcare providers for medical advice about adverse events. Report negative side effects of vaccines to the U.S. Food and Drug Administration, FDA, and the Centers for Disease Control and Prevention, CDC. Visit http://www.theirs.hhs.gov or call 1-800-822-7967. In addition, you can report side effects to Pfizer Inc. at www.pfizersafetyreporting.com or by calling 1-800-438-1985.